Welcome to Rethink Healthcare. It is Wendy Ball and
Mr. Montenegro.
Mr. Montenegro. He has arrived.
Yes, I'm here and I'm here to stay. So what's our topic today?
What is our topic? Oh yes, I remember.
What is it?
Communication.
What?
Communication.
Communication. Okay. So what is...
Communicating effectively.
So there's always a sender and a receiver.
There is. You send your message and then you receive it.
But I think it's not traditional somebody sends and somebody receives. I think it's really multi-directional.
Because then you send and receive.
I think it's just naturally happens.
It does.
Right? I mean, from...
I don't know with this new generation how they
go like this.
But that's still communication. That is such a good point because
Yes.
we communicate verbally.
Yes.
We communicate non-verbally.
Not
Like if I went like this to you, what would this mean?
That you're very hungry?
Yes. No. That would be FDN. If I went like this, what would this mean?
You're cheesy?
Yes, exactly. See, non-verbal. But then we have communication via text. We have got a lot of electronic communication that we have to, like even the students in school, right? We're dealing with a lot of electronic communication, and then we move into healthcare and we have electronic communication.
Don't forget though, the cultural differences. What may mean to one culture is different to another.
Absolutely, and that's a big thing, especially for NCLEX, and make sure you know your cultural differences for sure.
Yes, because there are cultural competence questions that go along with that. It may also fall under the religious aspects of it. So that kind of is part of the cultural competence that you're going to need to know. Now, language too. I mean, certain phrases mean things. So, for example, when I climbed Mount Kilimanjaro, and from a language perspective, right, this is very crucial because in Swahili, when they say pole pole, that's like your guide will tell you pole pole, means just like take your time, slow down. You don't rush up the mountain because you want to slowly acclimate.
I can't rush up the mountain, so I'll just pole pole.
But for here, right, for what I understand. And this I really have to verify, but what I was told was in Korean, I think pale pale means fast. Is that right?
Oh, I don't know, and I should know that with my Unipetunia living with us.
But that was somebody told me. So there was an incident wherein you had a Swahili guy, a Kenyan guy, who spoke Swahili, was doing the pole pole, but the Korean climber, who didn't really obviously had a miscommunication, was thinking
fast.
The guy was telling, "Come on, fast." So the signals crossed there. They were trying to do this. The interpretation was incorrect.
Yes. And you go along with that. In the U.S., we have so many different countries, so many different languages represented.
Yes.
So we have that language barrier that we need to learn how to communicate with patients that may speak a different language.
Yes.
But also, you're right, different kind of phrases or what something means may mean something different. Or even, I know in the U.S., when somebody's listening, I always think of good eye contact. They're paying attention. They have that good eye contact. In other cultures, if you make eye contact, that's disrespectful.
Like in an Asian culture, they may shy away from direct eye contact, and it may be perceived as, why are they ignoring me? They're not listening to me. However, they're just being respectful.
Yes. So being here in the U.S., we have all those different cultures to contend with and understand. And it's important for us we're not going to know everything, but to have a basic understanding and know that we're all different and we all communicate differently. So how are we going to communicate in healthcare? What is some of the ways we can communicate well with our patients, communicate well with other healthcare providers?
I think barring any language gaps, anything like that. I mean, I think with any interpersonal relationships, right? I think the core with that will be respect,
Okay.
right? So it doesn't matter even if you don't understand the language. That let's say that neither party speaks the same language, right? I mean, if you could have the intent of how do I maintain respect for this person, you'll be able to sense it, from a nonverbal way.
Yes. And that's great because we want our patients to trust us.
Yes.
So we want them to know that we respect them, we respect their boundaries, we respect their culture, we respect them as an individual. So then they will trust us, they will call on us, they will, how about communicating with other healthcare providers? That can be tricky sometimes. Have you ever had any problems?
Not necessarily. I mean,
perfect over here.
No, but I think that the whole gist of that is communicating directly, especially if you're communicating to another healthcare provider. You can just go straight to the point. I mean, if there's a problem going on with the patient, just go straight through. Hey, here's what I'm seeing. What can we do? I mean, there's always a commonality amongst providers of healthcare in. Our commonality is treating that patient.
Yes.
So what do we do? Even let's say even if you have a personality clash, put that aside and just say, okay, well, here's what we're trying to figure out. How do we get Mr. X better?
Yes. I feel like sometimes my students may get a little intimidated,
Of course.
speaking to some healthcare providers. I always tell them the physician, they put their pants on one leg at a time too. They are a person. Yes, we respect them. We respect everybody in the healthcare profession, but they have to learn to be able to talk with the providers, and if there is a problem or there's a problem with the patient, they have to share that, regardless, because sometimes I have had some physicians that are not so nice back to the nurses. So
I think that's just human nature. I mean, from a student's perspective, it's normal. It's normal to be intimidated. I mean, I think when we were students, remember the first time I had to go into a patient's room?
they were like, whoop.
I was like, what am I supposed to do here? Seriously, but it's normal. But the more you do it, you get comfortable at it. That's where exposure, and that's why you're in training. You're in training to improve. Now, once you're licensed, yes, we're always learning. So always keep that in mind. I mean, it's not just about what am I learning in school, but how do I communicate better? That's something you could do outside of school.
And I think it's key that we really need to advocate for our patients. So if we think there's a problem, we can't be afraid to advocate. And I think you brought up another point about even conflict among peers and other healthcare, but you're not going to like everybody. It's just, you don't have to be best friends with everybody, but you have to be professional in the way that you communicate.
Yes.
I think that is super important, that we're professional and we don't have to, go out to lunch or dinner with that person or be BFFs, but we need to respect each other, and we're there to do a job to care for the patients. So.
And ultimately as the nurse, you have to be the advocate for the patient.
Yeah.
So from your student's perspective, you always I guess impress upon that, like, okay, how do you become your best patient advocate?
Yeah, and I always say, watch how you're communicating too. Sometimes we can pick up on how other people are communicating, but we also want to be, with communication, we want to be good listeners. If our patients are sharing something with us, we do want to listen. That is part of communication, because they may be telling us important things, right? That we may, not pick up on if we don't stop and listen, and it may be very important to their health.
Yeah, I myself have had to really readjust a bit. As a nurse practitioner, I'm kind of focusing now on geriatric primary care, and one of the things that I find is I have to really take time, because it takes my patients time to tell me what I need to know.
You have to slow down.
Yeah, no, and I have to really just sit there, because their tone and their demeanor and how they communicate is just naturally slower.
Yeah.
So I just have to be patient myself and just say, okay, so, and and what is it that they're really trying to tell me? And then instead of saying, okay, I got to do this, and this. I mean, no, I've had to really sit down and really, for the most part, is if I spend probably 80% of the time listening in my whole encounter with them, I actually think that that's a good
good
ratio.
balance.
Yeah, especially in the elderly population that I'm serving.
And I think you bring up a great point as we wrap things up about how we communicate with different age groups, right? The elderly patients you're going to communicate with differently than a 2-year-old. I'm not going to ask a 2-year-old, what is your pain from 0 to 10, right? I'm going to communicate differently. I'm going to get down on their level. So there's lots of ways we can effectively communicate with patients, with each other, with different age groups.
Of course, yeah. Like my teenage daughter. Yo, what'd you do today? Nothing.
Yeah, can't get much out of those teenage daughters, can you?
How about you? Is that how your interaction is with your? Well, you don't have any teenage daughters.
No, they're all in their 20s now.
So you're more like house life question.
Yes, it's more like, my
pay your
oldest
mortgage.
just got the house, and it's like I'm so excited my basement stayed dry. So
Gotcha.
conversations change, but
Gotcha.
we're always working on communication.
Yeah, no, it's part of life.
Okay.
Till we die.
Yeah. Well, that's a wrap then.
Yes.
Okay.
Alrighty.
We'll see ya next time.